If you're found to be HIV positive, does whether you get on these wonderful drugs depend on where you live?
Currently, yes, it does, unfortunately. NASTAD, my organization, does every week AIDS Watch, ADAP Watch, I'm sorry, which is, ADAP is the AIDS Drug Assistance Program. And unfortunately, currently, this has always been there's always been a waiting list, but the waiting list to get on these medicines and treatments that are saving lives keeps growing. And so now there's over 8,000 individuals across the country. And unfortunately, a lot of the 13 states that have ADAP waiting list, a lot of them are in the South. And so, fortunately, as Guillermo and other ones mentioned, that New York right now does not have an ADAP waiting list, but states in the South have, Florida being one that has the largest.
How do we get a waiting list in the United States for ARVs when the United States government is keeping half the people who are currently on ARVs in the world on the drugs? I mean, should you leave Georgia and go to Botswana? Should you leave South Carolina and move to Mozambique? It's a startling kind of thing to realize that the United States government is wonderfully, remarkably, keeping millions of people alive in the poorest places on earth. But if you're in Huntsville, Alabama, you might not be able to get on ARVs. What's going on?
I think it's a product of our healthcare system. It's a product of the expensiveness of the drugs. It's a product of sort of our country in terms of how we operate. And I think that one of the things that in your earlier piece that Guillermo Chacon mentioned was we now have some really good public health initiatives that will really help to sort of, I think, stem that. The National HIV/AIDS Strategy, which really looks to reduce HIV infections, increase access to care, and minimize health disparities, along with really, and probably more importantly, the Affordable Care Act, that by 2014, for people living with HIV and AIDS, they will be eligible for Medicaid in order to be able to secure their medications. What Francisco mentioned earlier in terms of those ADAP waiting lists, he mentioned 8,000 people on those waiting lists across this country, a lot of them being in the South. But there are many other states that are actually enacting cost containment measures, reducing their formulators in order to try and minimize the fact that there might not be people on waiting lists. So that number is probably not even real. Mm-hmm. It's probably much more than we in this country than we imagine. And we also believe as advocates that it is incomprehensible that in an industrialized country like the United States, that we can actually tell people that you need to be put on a waiting list and your life may or may not be able to be saved by the fact that you may or may not be able to get access to drug.
Mary Beth, this becomes even more critical in the light of the research that was released just in the past few weeks showing that putting someone on ARVs doesn't just save their life, though it does, but it also reduces the possibility of new infections, doesn't it?
It does. So what happens is if you have less HIV floating around in your body, you're less likely to transmit it. Makes a lot of sense. What makes the United States different from other countries is that we in the United States provide plenty of money to other countries for their HIV efforts, but we would never do that if that country didn't have a national AIDS strategy. So you've asked what's changed in the last 30 years? Well, for the first time in 30 years, we have a national AIDS strategy. So we're looking at how can we provide HIV medication here to our own population. And yes, it's true, if you're a person living with HIV, and you're at a point in your disease where medication is recommended, you are better in Botswana, in Brazil, in Barbados than you are here in the United States. Why? Well, they have national AIDS strategies that they started and that they implemented. And it's very hard to, on the one hand, convince people to get tested for HIV because if they get tested early, they can get treated early on the one hand, and on the other hand, we've got 8,111 people on an ADAP waiting list. And so we need to take a more cohesive, coherent response. And so the AIDS strategy has been around for 1 year. So we're about to see whether or not it's worth more than the paper it's been written on. We've got a 1-year evaluation coming up, but that's the big change in terms of the US approach in 30 years, is that for the first time in 30 years, we actually have a comprehensive strategy that specifically addresses the meeting or fixing the health disparities and access to care among minorities, including Latinos.
Liliana, if you realize you need the drugs, but you're not someone who knows how to contact anyone, work the system, find out what you need to find out, Are there go-betweens? Can you get help, for instance, in Spanish to work the system for you and get you into ARVs?
That's a really great question, and there are a lot of different resources within the community that you can go to. Community health centers are a big one. There's a lot of AIDS service centers. There is organizations that work with NASDAQ, for example, health departments that could point you to additional resources. I do know that a lot of these organizations have websites where you can go and directly type in your zip code, and you can get the address of a Planned Parenthood location, for example, that can provide HIV testing and counseling, and then from there refer you to a treatment service center. So there are various options.